Namaskar. I am Gayatri, your anchor for today's Cardio Kidney Metabolic Connect talk show held in Cardiology Conference in Kolkata. In our initiative to build mass awareness about cardio kidney metabolic diseases, which is impacting every Indian household in current times because of growing incidence of sudden heart attack, kidney problem, and diabetes. To throw more light on this, today we have with us Dr. Sai Ravi Shankar from Hyderabad. Welcome, Doctor.
Thank you.
Doctor, can you briefly introduce about yourself to the viewers?
I am Dr. Sai Ravi Shankar. I am a senior consultant cardiologist at Virenchi Hospital, Hyderabad.
Doctor, my first question to you is how to prevent young heart attack?
Young heart attack, we have to see the main predisposing factor. Of late, we know that only BP, hypertension, diabetes, cholesterol is the main risk factor to heart attack. But of late, we have seen that the number of young heart attack less than 35 years are growing drastically. So we have came to know that the risk factors for the young heart attack and the elderly population more than 45 are totally different. And in Asian population, the heart attack comes 10 years earlier than compared with the Western population. So young heart attack less than 35 years, the risk factors are: number one is the mental stress. The mental stress is a very important risk factor for the young heart attack. Second is the sedentary lifestyle. The young heart attack, they don't do any proper exercise, only they are just screen time will be almost 8 to 9 hours. They don't do normal 45 minutes per day, 5 days in a week exercise. Number three is the junk foods, fast food, unhealthy foods they are almost taking, and the dietary pattern is totally unhealthy. That's the reason, one of the important factors for the young heart attack. And number four is the most important, is the deprived of the sleep. A normal human body is required at least 7 to 8 hours of the normal sleep. They are deprived of the altered sleep pattern, which is a very important. Other than that, there are few risk factors, emerging risk factors like the environment, pollution, also one of the risk factors. These are and other than that, you are having any family history of first degree of heart attack, like your father, mother, or brother who has suffered a sudden cardiac death or a acute MI or a stent, anybody, you have to be very careful. These are the patients who are very prone for the heart attack, young heart attacks.
Thank you, Doctor. Doctor, my second question to you is how to differentiate pain caused by heart attack and pain caused due to gastric problem?
It is very difficult to differentiate between the heart attack pain and the gastric pain or a muscular pain. But the few points which I am going to tell you right now, a patient with a risk factor like predisposing factor like obesity and the unhealthy diet and a smoker, hypertensive, or a family history of having a diabetes patient, if he gets a chest pain, left-sided chest pain, which is a pricking type of chest pain and which is radiating to the left hand and with the sweating and breathlessness and very tired, this is very typical of heart attack. And if the patient is having pain in the angle of the mandible, and the patient, if the pain is aggravating, if the patient is moving some little bit, some walking or some sort of exercise, patient, the pain is aggravating, that is a typical of heart attack. Number one. Number two, the typical of gastric pain is very clear. The patient is an empty stomach, patient will get some type of pain, and the patient gets, if the patient takes some food, the pain relieves. That is a typically around the umbilicus, this pain will be there. It won't associated with any breathlessness, may be associated with some sweating, but this is a typical, maybe for a couple of years it is there. But the heart attack, patient do some exercise or walking, patient chest pain will increase. If the patient takes rest or taking some sorbitrate, the pain will relieve. This is a clear-cut difference between the cardiac pain and the gastric pain. If any pain which is by pressing anything, it is going, the pain will aggravate, that is a typical of muscular pain. So these are the few things, but one important thing I just want to tell is those are having a diabetes, you will not get any typical chest pain. Atypical chest pains also is very common, and diabetic population you may not get a chest pain, but you will get a breathlessness, sweating, perfusion, and the fatigability. These are the very common. And there are 30 to 40%, even though you are having a heart attack, the atypical symptoms of the chest pain like back pain or stomach pain These are the and severe vomiting. This is characteristic. So any pain, if you are having a risk factor, please consult the doctor and do a minimum ECG test to find out and rule out any cardiovascular disease.
Thank you, doctor. Now your message to the viewers to keep their heart healthy.
Heart healthy, beyond this risk factor like hypertension, diabetes, high cholesterol, you have to control that. Beyond this risk factor, my very clear-cut message to this viewers is, please do regular exercise at least 45 minutes per day. Take healthy diet. Don't take any junk food, fast foods, which is a very high in triglyceride and LDL cholesterol. Take proper sleep, and as much as possible, please reduce your mental stress, which is the most common cause nowadays for the young heart attack.
Thank you, doctor, for
Thank
your
you.
valuable advice on how to keep our heart healthy and how to protect ourselves and a loved one from cardio, kidney, metabolic diseases. For more such information, log on to Cardio Kidney Metabolic Connect and Dil Se Dil Tak Healthy Heart Talk Show on Facebook, Instagram, Twitter, YouTube. Thank you.